Welcome to your Barbados Today Evening News Update for Thursday, March 26. Bridgetown and Havana have finalized and inked an agreement, paving the way for Barbados to get the Cuban Interferon medication for the treatment of patients with severe cases of the coronavirus COVID-19. The deal was cemented last evening between the two countries following days of discussion. The Cuban ambassador to Barbados outlined some of the details to Barbados Today.
The agreement is all ready to start providing the product. As it will be served as needed. But the question is that we have already established the way to get it into the system in Barbados, and I believe that in probably in a couple of weeks we will be able to have the availability of the product at the local attention. This will deal with the treatment of those severe cases that arise from the appearance of here in Barbados of this disease. Right now, fortunately, both in Cuba and Barbados, the rate of infection has been low and kept contained. We don't have very severe cases yet. So we have the time to bring the product and start.
Meanwhile, the two countries are also finalizing arrangements that would allow Barbados to benefit from the expertise of specialist nurses and doctors from Cuba.
It's in the making, but you know, right now we have been answering those early requests, and I'm sure Cuba will be able to answer all requests for support of specialists and doctors and nurses. Nurses are very important.
The Child Care Board is cutting some of its workers as the number of children attending government-operated daycare centers dwindles in light of COVID-19. Substitutes who serve as relief workers during instances of leave have been affected by the move, as well as some workers with short-term contracts who were asked to stay at home for the remainder of the month. The board said the workers have received all outstanding pay and will be reabsorbed into the residential care program from April 1 if the current situation continues. Meanwhile, the Child Care Board says its day nurseries are still open for business and strict guidelines will be enforced to ensure the safety of staff, children, and parents. The Caribbean Examination Council has postponed its exams until July. At a news conference today, Chief Executive Officer Wayne Wesley announced that regional exams would have to be modified because of the COVID-19 outbreak across the region.
1. The administration of at least one common paper, and in this case, the multiple choice assessment. 2. The utilization of school-based assessment and the paper 3-2, which is the alternative to SBA for private candidates. 3. Awarding final grades based on the moderated SBA and the multiple choice assessments. The following are exceptions to the aforementioned process, where candidates will be required to complete additional components: modern languages, Spanish, French, and Portuguese, human and social biology, and visual arts. This strategy will employ the e-testing modality online and offline in order to reduce the administration processing time, resulting in the shortest turnaround time for marking and releasing of examination results.
There's regional and international news after this short break.
It's Festive Friday at the Bridgetown Night Market at Pelican Craft Center. Kick off the weekend this Friday from 4 p.m. to midnight with loads of food, drinks, and entertainment. Get ready for Crop Over with the Rhythm Roots Street Parade. Party like it's Kadooman Day on the street around Pelican Village with costume reveler, music, and more. It's Festive Friday. It's Festive Friday at the Bridgetown Night Market at Pelican Village Center from 4 p.m. to midnight. Admission free.
To regional news now, the Trinidad and Tobago government today announced that all non-essential workers will have to remain at home from Sunday. Prime Minister Dr. Keith Rowley says it should not be seen as a lockdown, but as another step to curb the rate of COVID-19 infections, which now stand at 61. Speaking at the end of the cabinet meeting, Dr. Rowley also defended his government's decision not to reopen the country's borders to allow 35 Trinidadians in Barbados to come home.
This government will take reasonable actions, and the reasonable action we have taken is to know that our people in Barbados are in quarantine. At the end of the quarantine period, they'll be tested there, and when they reach the WHO standard to be released, if they make their way to Trinidad and Tobago, they will arrive here and then be subject to the CMO in Trinidad and Tobago. Why is that so difficult to understand? This particular situation was the subject of conversation between the prime ministers and attorney generals of these two territories. And I will say here today, stressed as we are, that the opposition leader going behind the government back to the government of Barbados against statements that this country has made its citizens stateless is yet another example of the opposition in Trinidad and Tobago not prepared to be responsible in this case in a period of crisis, but seeking to score political points.
Further afield, the United States on Thursday surpassed China and Italy as the country with the most coronavirus cases, according to a Reuters tally. New York, New Orleans, and other hotspots face a surge in hospitalizations and looming shortages in supplies, staff, and sick beds. More in this report from Reuters Television.
The number of deaths from the coronavirus in the United States shot past 1,000 on Thursday, as hospitals across the country struggled to treat a surge of patients. Leading the nation in both deaths and infections is New York, where Governor Andrew Cuomo, who has been sounding the alarm about an expected shortage of hospital beds and ventilators, said on Thursday that the state's death toll jumped by 100 overnight.
The number of deaths is at 385. It's up from 285. And since we still have a large number of people on ventilators for a long period of time, the experts expect that number to continue to increase.
New Yorkers on Thursday continued to line up outside the emergency room entrance of Elmhurst Hospital in Queens, waiting to be screened for the coronavirus. Outside Bellevue Hospital in Manhattan, workers constructed a makeshift morgue to house an expected surge in bodies.
Almost any scenario that is realistic will overwhelm the capacity of the current healthcare system.
The country's next epicenter is likely to be New Orleans, which recorded the world's highest growth rate in coronavirus cases.
The problem isn't just that the cases are growing every day, it is that they're growing rapidly every day.
Some medical experts blame the spike in cases on last month's Mardi Gras, which one expert said provided the perfect conditions for the spread of the virus. The deteriorating situation in New Orleans dashed hopes that less densely populated cities and those in warmer climates might escape the worst of the pandemic. Local authorities have warned that hospitals in New Orleans could reach the point of collapse by April 4th.
That's news, but for the very latest, visit our website at www.barbadostoday.bb. You can also subscribe to our e-paper, email updates, or like us on Facebook, and sign up for our breaking news alerts via WhatsApp. We're also on Izumi Media and bus terminals, as well as Screenplay at supermarkets and gas stations near you. You can also hear us on Mix 96.9 FM and Capital Media HD 99.3 FM.